clean someone's trach is what? What would you have at the bedside? What do you set up?
Oxygen.
Yeah, I might need some oxygen, okay? You need your supplies, so you're gonna find out what your supplies, if you need a trach kit, if you need a suction catheter. What else are you gonna set up? You're gonna make sure your suction is up, working, okay? Okay, lift the patient up. So just because I have suction set up doesn't mean it works, right? Okay, so I always assume don't nothing work. If you do that in nursing, you'll be okay, all right? Just assume you need to come in. So when you come in and you start assessing, like I said, you start assessing that patient from the door. Okay, when I walk in, I'm assessing you from the door. What am I looking for? If you're in any type of distress, absolutely. What else am I looking for?
O2 sat.
O2 sats, that's right. Do you have a pulse oximeter on you? What else am I looking for?
If the patient was talking previously and now they're not.
Okay, he shouldn't be talking if he has a cuff trach. We're not gonna work.
Conscious.
If he's conscious, okay? If he's conscious.
No.
Okay, if he's talking and he's got a cuff trach, that's a problem. Okay? Okay, because the trach, what's gonna happen is when I blow that balloon up, it's gonna compress and it's gonna take away his vocal cords. He's not gonna be able to talk to you. If he's talking, that tells you that the cuff is, or you hear air moving around, and go, blah, blah, blah. Check your cuff. That means your cuff is deflated. Okay? What else?
Sputum coming out of his trach.
Huh?
Any sputum coming out of his
sputum
trach.
coming out of his trach. Okay? Any sputum coming out. All this your assessment. What else?
Check if there's any obstruction.
So if there's any obstruction, okay? I'm checking to see how much oxygen is he on. Okay? If he's on a ventilator, then that means that he's getting full support from his ventilator. How much oxygen is this person on? That tells me, A, how long I can possibly disconnect him from the oxygen to do this. Okay? If I walk up and he's not on any oxygen, that's good. Let me check his pulse ox, let me check his work of breathing. I may be able to get through this. If I walk in here, he's on a ventilator or he's on a trach collar and it's at 50%, then I may need somebody in there, because if he's not able to help, like this lovely lady on the, then I might need somebody in there to help me maneuver this, okay? Does that make sense? Okay? So I come in, I go, hi, Mr. Jones. Can you tell me your name? Date of birth. He won't be able to talk to you, okay? If he's conscious, he'll nod. You know, are you Mr. Jones? So that's why I have to check his wristband, okay? If he's conscious, he'll nod. Okay, so I have to identify the patient with two patient identifiers. He should not, if he has a cuff trach, he should not be able to talk to you. But that doesn't mean he's not conscious enough to nod his head, right? Okay. What else do I need to do before I do anything to him?
I can listen to his lungs.
Listen to his lungs. I'm going to tell him a little bit about what I'm going to do. They have a trach. They've probably been suctioned before. Okay. I say, I'm in here. I'm going to do your trach care. I might have to suction you out. How you doing today? You know, nod your head if you're doing okay. If he's on a monitor, I can see what his heart rate, his blood pressure. But I need to take a complete set of vital signs on this person. Okay. And I need to also anticipate what else is going to be needed. Can he sit up for me? Can he cooperate? Will he be able to notify me if he's in type of distress? So I then tell him I'm checking his equipment, okay, so, because I might have to oxygenate him. So this is, you have two things on the wall. This is your oxygen source, right, okay? And this is your vacuum. Your vacuum is what you use for suction, okay? So, you have, if you look at it, you have off switch here. Oh, whoa, that's big, should be like, off switches here, and what else? I know this. Y'all need to come closer. I know this. Come closer, people. You can't see this. Go and look at, what does it say? Off, and y'all know I get hands on. What does it tell you? Off and what else?
Continuous and intermittent.
Continuous and intermittent. Okay, so I have to make my decision. What do I want him on?
Continuous.
Continuous. Okay, familiarize yourself with this. Y'all let somebody else come. I like it when students stand back. I make you come cupping because you stand back there nodding your head and you don't know this. Come on, this is your chance to learn this. Get familiar. Because when you see it in a clinical setting, you'll say, I know it's off, it's continuous, and it's intermittent, right? Okay, and it tells me, right? Because they would say, well, how would you know he's on continuous? Duh, I just read it. Okay? Nursing is a contact sport. Okay, you got to get in there. Okay, there you go. Now we got it. Oh, that's how she got that, huh? Oh, she's so smart. I'm not that smart. I'm just reading every now and then. Okay? Absolutely. Go ahead and take a look at it. If you know, it still works for me. Yeah, look at that. How about that? It says off, continuous, and intermittent. Okay? So I have a choice on where I want to put his oxygen. Okay? So, I mean, his suction. So when I'm suctioning him, yes, I'm going to put it on, turn it to continuous, right? By the time I should hear the suction come on, what else do I need to do? I can dial his flow rate. Okay? This is how you dial his flow rate. Okay? And this will move up into the area is what?
Low, medium, high.
What does my suction need to be on?
125.
120.
This ain't a guessing game. Look at your sheet. This ain't a guessing game.
Between 100 and 120.
Absolutely. And where did you get that information from?
Check out.
Oh, you got it off the paper. Okay, come on now. So I gotta dial this here until it rests between 100 and 120. And you can see my choices are 100 to 125. So I need to dial it. Once I turn it on, dial it so it rests between there. Is that right? I got the proper amount of suction. Okay? Okay, y'all feel better already, huh? Okay. So then I would test my suction just to see if it's working. Okay? Just because, and like I said, when you hear it, and it's very loud, I don't know if
It's on the other side.
Is it on the other? Do it work?
Just twist the knob.
Oh, okay. Well, we won't be doing this long. Okay, this tells me if I, see, she's even got some creatures in there. Okay, what I put, okay? Continuous suction, okay? That tells you that it's not high enough, so I would have to dial it up until I get to 100 to 120, okay? So you should be able to hear suction in your room, okay? Suction is loud, okay? You can come in right away and tell if the suction is on or if the suction is off. Pay
It's
attention.
not that loud.
It's not that loud, but pay attention to the sound in your room. You can tell right away if if it's on, if it's off, okay? So like I said, once again, you test your suction to see if it's working, okay? So that's the suction, okay? What else do I need to do if I have to hyperoxygenate this person? So I'm just setting up, I'm just making sure, seeing how he's breathing. Okay, don't worry about it, I'm doing okay over here, okay? So if this person has to be hyperoxygenated and he does not have an oxygen collar on or something like that, I might have to use my bag mask, okay? Usually you all find it like this, right? Okay? And usually you go in it like this, right? He has a trach. This is how, if he has his pillow, go ahead and take his pillow from his head just a little. Oh, Lord. watch mama's wig, because you will get on your, okay? So you want to get some room up in here. Go ahead and lift your patient up. Like I'm just showing you how this would go, and then I'm going to show you the whole procedure. Go ahead and bring them up. People, for the most part, they don't know to take the mask off. Go ahead and bring them forward. This will be attached to an oxygen cord here, and you turn your oxygen up to 15 liters is the flow rate. You take this in here, you attach it to here. When he inhales, this is how you hyperoxygenate him if he doesn't have a collar, okay? If he's on a ventilator, I can possibly just hit the button and give him 100% oxygen, okay? So the biggest thing with this is that it's a bag mask oxygen device, okay, that you have to, because people are like, oh, I'm bag. Ooh, that's so funny. Take it off. Take it off. Connect it to there and then bag it. Does that make sense? Yes. Okay, that's hyperoxygenating. Okay, like I said, you may or may not have to do this, but this is how you would do it. Okay. Okay, so let's go ahead on with the skill itself. Okay. So the first thing I'm gonna come in, I'm gonna introduce myself. Hi, Mr. Jones. My name is Kathy. I'm your student nurse. Okay. Any type of pain? I can see if he can follow them. Can he nod his head? I'm trying to see how best to communicate with him. Okay. I check his name, 2 patient identifiers, right? Okay. Well, I wash my hands too, so I can't. Okay. I'm going to assess this patient. Okay. I'm going to listen to his lung sounds. Okay. See what he sounds like. Why?
See if he got fluid in his lungs.
So if he has fluids, I have a before or after. Okay. His work of breathing. Okay. What's his pulse ox? What's his heart rate? Okay. What's his blood pressure? Okay. So I have to assess it. Okay. So his vital signs workout, that's fine. I'm going to tell him what I'm going to do. I said, I'm going to suction you. You know, I'm going to say he has coarse bronchi. So I'm going to say I need to suction this patient just for the sake of demonstration. Okay. So what I need to suction this patient?
Just suction kit.
Yeah, I need a suction kit. Okay. I can make the decision right away, and looking at your sheet, let's go down your sheet. Introduce yourself, perform high signs and symptoms of airway obstruction, okay? Explain the procedure, so you tell them what you're gonna do. Most times people are with you and they have a trach, they have had it before. Obtain the vital signs. Then, like I say, check your suction machine. Make sure it's set up, make sure it's connected, turn it to continuous. What is the rate?
100 to 200.
100, 120. Go ahead and test it. You know, I should put on gloves because this is probably dirty by the end. So put your gloves on. Put your gloves on because these secretions. They secretions. Okay. So go ahead and test that and make sure it's working. Okay, I didn't turn it back on because it gives everybody a headache. Y'all kind of get what it sounds like. Okay?
Did y'all lock the
You
bed?
okay? Yeah, go ahead and lock the bed.
Push
Somebody know how to lock the bed?
Push the red tabs
That's a
on
nursing
the.
skill. Let's see, can they lock the bed? There you go. Good for that.
It's this one that needs to be locked.
There you go, see? Look, they lock the bed. Look at this stuff we learning today. So hold this, I'm gonna need this to work here. I'm gonna need my bedside table. I'm gonna start setting up. Okay. Okay, so at this time, like I said, I can make the decision to hyperoxygenate him if he needs it, just for the sake of it. Hyperoxygenate him, I guess. Let me get the suction. So I need a suction catheter, right?
How long would you hyperoxygenate them before you get started?
Just for a couple of seconds. I would hyperoxygenate no more than, did they give you a time? No more than what I think he needs.
10 seconds.
10 seconds is about all I need to do it though. So if I came in, I would just see what it is. Here's the deal.
Actually, it does say 30 seconds.
30 seconds to hyperoxygenate him, okay. If your goal, if he's a little bit, okay, if they hyperoxygenate him for 30 seconds. And this just tells you how much the patient can tolerate, you know. This gives him a better chance at doing what? Surviving while you don't have any oxygen. Here's the deal, he's got what in his lung? Fluids. So what am I trying to do? I'm trying to give him some oxygen that'll let him sustain his airway until I can suction him out, right? So what am I bagging against? Fluid, okay?
And pushing it out.
But I'm still trying to get gas exchange, okay? So I see that his numbers have come up. He looks a little bit better. I then have to give him a chance to catch his breath. Because like I said, every time you do something to someone with the trach, they're gonna cough, okay? So at that point, I'm watching him, seeing how he's doing and things, and I'm setting up for, if he has secretions in his mouth, I can also hook it to a yanker and stuff like that and get the secretions out of his mouth. Sometimes people have secretions in their mouth. This is the yanker, so you can go in his mouth. Trust me, this is not what you use to go down here. This is only for his mouth, okay? It's a yanker, okay? 2 different suction devices, okay? So I have my suction catheter kit. What else do I need to go along with this?
Sterile gloves.
A drape.
I don't have any drape. May or may not need it. I need saline. I need saline. I need a drape where?
Across the patient.
Him, right, because he's gonna have a secretion, yeah. So go ahead and drape the patient. Yeah, so your suction catheter kit, let me show you a trick about this. So smart. Okay, it's going to have in it a pair of gloves. It'll have a little box that you put your saline in, and then it'll have a suction catheter itself. Depending on how you open this, you're gonna fight with it. You open it like this. Well, the first thing I need is my gloves, right? They're at the bottom. So if I take this thing and turn it over, and I open it this way, who's on top?
Gloves.
The gloves are on top, and these things are always gonna get stuck, so. Okay. The gloves are on top. So watch how you open your catheter kit, okay? So what else do I need to do now?
Remove your gloves without touching anything else.
Remove my gloves without touching anything else.
Open the lid to your saline.
Absolutely, open the lid to my saline. I would open the lid to my saline first, okay? I would open the lid so I could get to that. It's a thinking game. So find out what works for you. We're not necessarily talking about if you did, but you know once you open it, you know your hands is gonna be what? You're gonna be down to one hand. So I'm gonna get in position. I'm gonna bring this closer to me. I'm gonna have the suction on. I'm gonna bring this right to him. Okay, so it's close. Because I can't be messing around once I get these gloves on, right?
It come out.
Huh?
It come out.
Oh, that's okay. We wasn't gonna suction no way, okay? So put your gloves on. I wonder if she gonna stay sterile. Can the teacher do it? Cause I can't. If you break sterility, what are you gonna tell us?
I broke sterility. I would get a new pair of sterile gloves.
Absolutely, cause that's what I'm gonna tell y'all, right? Trying to make me perfect. Okay, so here, this is all still sterile, right?
Yes, ma'am.
Okay, so I can open this up. Okay, let me drop that there. What else would I need to do?
Unfold your cup.
Unfold my cup. Is it all still sterile?
Yes, ma'am.
Okay, it is what it is. I probably should have went about it a different way, but it is what it is.
You can't just dip the tube into the saline bottle.
Huh?
You can't just dip the tube into the saline
What
bottle.
if you need more saline later?
Because isn't the
It'll still be
tube sterile?
Why would you want to do that when you have this beautiful box here? I'm just saying, why would you not?
Because to pour it, you'd have to touch the bottle.
Okay, well, yeah, you have to touch it, but you're gonna end up working with one hand anyway.
You gotta have
Here
one
it is.
one clean hand
So
and one
here it
sterile
is, you
hand.
gotta figure out who's dirty, who's clean. Okay, so he's gonna stay what?
Clean, sterile.
And he's got to be dirty, because what am I about to do? Pick this up and pour it in there. Okay, so I got a little, since I'm not, well, I guess you got it set up. Should I pour it?
Yeah. Yes.
Pour it?
Pour it.
Pour it, pour it, pour it, pour it, pour it.
I think that's why in the video she only put one glove on first.
Well, she's
But she
better
had
than
to
me.
put on gloves.
Yeah.
They were both on top.
I know. I'm talking about the sterile liquid. Remember, she only had one glove on. She did it with a bare hand, and then put the other glove on.
Okay, so what else?
Dip it.
Can I do this?
I'll connect it to the
Suction with the.
Okay, can I do this?
But then I get my sizes.
No.
Huh? Did I break sterility?
Yes.
How?
By grabbing the box.
And then
You
you.
contaminated
So-
the actual tube.
Why is this contaminated?
Because that one you already
Because you
touched the
have
bottle
hands
with that
on the
one.
bottle.
You have to use not to catch the bottle